Okay, I'm about to begin my informative speech on autism. The question is, what is autism? Autism, also called autism syndrome disease, is a mental condition present from early childhood, characterized by difficulty in communicating and forming relationships with other people and using language and abstract concepts. There are three spectrums of autism, and the first one is autistic disorder, and this is the classic autism. It is a disorder that usually appears during the first 3 years of life. A child with autism appears to live their own life and live in their own world, showing little interest in others and a lack of social awareness. Asperger's syndrome often remains undiagnosed because it usually shows up when a child isn't performing well in school or when an adult isn't performing well in their workplace. Pervasive development disorder, which is the best known kind of autism, and it is most common in children who have problems communicating and playing with other children. Autism, which can be detected during the early brain development, is more common in males. Study shows that men have a greater risk at being autistic than a woman has. Treatment for autism consists of therapy. Going to therapy may reduce the symptoms and support developmental and learning so that the autism can get better or so that the child can grow out of it. Another form of treatment includes a specialist, like a speech therapist or an occupational therapist or even a clinical psychologist. Common symptoms include difficulty with communicating with others, like some autistic children, they don't do well with other children. They don't want to talk to them. They want to play alone or whatever. They want to be antisocial. Obsessive interest, like if, say for instance, an autistic child gets a toy, like their whole focus and main focus is going to be on their toy. Like they're not going to listen to nothing that nobody's saying around them. They're going to tune them out and they're going to, do what it is that they are focused on. And repetitive behaviors. I have a cousin that has autism, well, the autism spectrum, by the way, which is a male, and he is 3 years old. He has a short attention span and does not interact well with children at all. He plays alone. He does not interact. He goes to school, but he does not play with the other children. His form of treatment is seeing a specialist, a speech specialist, because although he can talk, he cannot complete his sentences. And he speaks when he wants to. Like if a teacher asks him to say something, he won't say it. In his therapy sessions, they evaluate him and they let him play with toys and just monitor him just to see like how bad it is his autism is. Autism, it isn't as bad as it seems. Like people feel like it's in the world, like if their child have autism, but it really can be. Your child really can grow out of it, and some kids that have autism, they are really like the smart ones. So most people, they tend to grow out of it and they live normal lives. And that's it. Thank you for watching.